For nearly a century, the medical consensus for treating breast cancer relied on a single, aggressive procedure, the Halsted Radical Mastectomy. This approach was driven by the centrifugal theory. Surgeons believed that breast cancer spread in a slow, continuous, outward ring from the original tumor. To trap the disease, the surgical logic dictated that doctors had to cut wider than those expanding rings. That meant removing the entire breast, the lymph nodes, and the underlying chest muscles. Women endured massive physical disfigurement from these operations. It was accepted by patients and doctors alike because the medical establishment insisted it was the absolute requirement for survival. For decades, the medical community prioritized this aggressive mechanical extraction over a deeper understanding of the biology of the disease. By the mid-20th century, a sense of clinical frustration was building. Despite surgeons making wider and deeper cuts, patient survival rates were not improving. Doctors faced an anomaly they couldn't ignore. If the cancer was completely removed at the local site on the chest, why were patients still dying from disease appearing in distant organs? This suggested that the mechanical, outward-spreading model of cancer might be completely wrong. To solve this mystery, researchers needed to put down the scalpel and look closer at the microscopic biology of the cell. Dr. Bernard Fisher was a surgeon willing to challenge a century of unquestioned surgical tradition. He proposed the systemic hypothesis. He argued that breast cancer micrometastasized early, meaning tiny cancer cells were breaking off and traveling through the bloodstream and lymph systems long before a patient ever reached the operating table. If the disease is already systemic and traveling through the body from the start, performing extreme local surgeries on the chest is pointless. To rigorously test this idea, Fisher and his colleagues formed the National Surgical Adjuvant Breast and Bowel Project, or NSABP. Proving this systemic disease model required stripping away emotional surgical traditions and relying entirely on massive sets of randomized clinical data. In 1971, the group launched the B-04 trial. It pitted the Halsted Radical Mastectomy directly against far less extensive surgeries to see which group actually lived longer. Following that, they launched the even more controversial B-06 trial, testing a total mastectomy against a much smaller, largely unheard-of procedure, the lumpectomy. A lumpectomy involves removing only the tumor and enough normal tissue to ensure clear margins, abandoning the massive all-at-once removal approach. The medical establishment pushed back intensely. Many surgeons viewed leaving any breast tissue behind as dangerous and unethical. Fisher was putting the entire history of surgical oncology on trial. The final verdict would take decades of tracking patient survival to prove. After 20 years, the B-06 trial data was published, plotting overall survival for total mastectomy, lumpectomy alone, and lumpectomy with radiation. The lines converged, showing no significant difference. Survival outcomes were statistically equivalent regardless of how much tissue was removed. This chart shows Figure 3 from the report, mapping the cumulative incidence of death. It revealed that total deaths, as well as deaths following a recurrence, remained remarkably similar over 20 years, whether women received a lumpectomy alone or a lumpectomy with radiation. The data proved the central thesis. Removing more tissue locally did absolutely nothing to save more lives. These findings forced a global pivot in medicine, moving towards breast-conserving surgery combined with systemic therapies like radiation and chemotherapy. The NSABP report concluded that the lumpectomy represents a complete departure from Halsted's old mechanical, outward-spreading biological principles. Modern oncology now treats breast cancer systemically throughout the body, rather than just surgically punishing the local tissue. The eradication of the radical mastectomy shows that in science, dismantling entrenched dogma with rigorous long-term data is the only true path to a cure.